Good evening, guys, and welcome back to We Are House of Medics. It's me, your favourite, Tanisha, and joined with me is...
Your new favourite, Dr Bolus.
So joined with me is Dr Bolu. So we're going to get straight into it. Do you know what? We should have actually planned a game.
Oh, okay.
In fact, we're going to do a game now.
Okay.
Cool. So we're going to play... But don't go left with it though, Bolu, because there's students watching, okay?
No, we're keeping everything PG.
Bolu.
YouTube, monetized.
Bolu, don't go left with it, okay?
Okay. I don't know where you're taking me.
Actually, no, we're not going to do that one. We're going to do two truths and a lie. And I know I always do this one, guys, but I like this one, okay?
Okay.
So I'm going to start because it's ladies first. Right. So, two truths and a lie. I used to have goldfish.
Okay.
Quite a lot of goldfish.
Okay.
And obviously he's a vet, so...
I like how you elaborated quite a lot as well. That doesn't make it...
I have been swamped by quicksand before.
Okay.
And I'm allergic to seafood.
Is this like that game show where you get to ask about the two truths and like I can poke a question and ask me?
No, you have to just guess which one.
I just have to guess which one's the truth.
Yeah, you just have to guess which one is
Say
the
them
truth.
again?
Okay, I used to have a lot of goldfish. I got swamped by quicksand when I was younger, and I'm allergic to seafood.
Yeah, okay, cool. All right.
You're trying to read my eyes and body language in it, but you're not quite there, are you?
No, because the first two are true and the last one's a lie.
No, see, you're wrong.
It's the first and third.
So the first is a lie.
Okay.
Actually, do you know what?
Oof, you
They were all true.
They were all true.
Actually, no, they weren't all true. They weren't all true. I didn't have a lot of goldfish. No, I didn't.
Just three truths.
So I only had one goldfish. I did I sunk into quicksand when I was younger, and I am allergic to seafood or shellfish. Anyway. So it was two truths and a lie. So you got it wrong.
Wait, which was the lie? The first one?
The goldfish, yeah.
But then why did you think it was the truth?
I don't know.
How did you model up?
Not me, Bolu. Let's to you now.
Okay.
Okay, cool. Your two truths and a lie.
Wow, two truths and a lie.
Because you've been telling us so much stuff. Remember,
I know, there's so many things.
Saying to you, stop, but you didn't want to stop.
There's so many things, but I'm not a liar, you know. I'm a good guy, so I don't know how to lie.
That means the first one is a lie.
Yeah. Wow. Whoa. What can I lie to you about? Okay.
Time to date, buddy.
Okay, cool. Fine. I've been to Mount Everest. Okay. I was captain of my school football team.
Okay.
And I have partied with Jamie Foxx.
I think the thing is you've travelled, so I don't know if the mountain thing is a lie. I think, but you're also athletic, so you might have played football. I think the football thing is a lie.
Yeah.
Yeah?
Yeah.
See? That's why it's my favourite game, because I always win.
Got it.
Thank you.
You got yourself.
Cool. So guys, as usual, give us a thumbs up. Please like this video and send all your questions ahead of time. So let's get straight into it. So Bolu is a vet. See, even Nana over there said Jamie Foxx is a lie, but it wasn't the lie. It wasn't the lie. So cool, yes, please make sure you like this video and send your questions in ahead of any other things we might discuss later. So anything you want to know containing anything to do with animals, send your questions in now. So Bolu, animals, how did you even... Because most black people...
Yeah, this is why I'm here. Let's go. This is the real reason why I'm here. Let's go. Let's go.
I'm sure Leah was here because Leah loves animals, but most black people don't really like dogs and cats and those kind of things. I had a hamster and
no goldfish.
I mean, I did. I had one goldfish, okay? I had one goldfish. Okay. I lost the hamster in the house and then I found the hamster, but it made the house smell really bad. But I did want like a little dog, but I wasn't allowed. Okay. So why do you like animals so much? And is it only like dogs and cats you like? Do you keep spiders?
Not really. It's just weird. That's weird that you say that as well, because sometimes I might kill them, but I prefer to be like, oh, you know, you're doing good in the world. Yeah, it's very weird when you say that now. Now that I think about it, it's very. But yeah, I'll be like, oh, you're doing good, so you continue. Or I'll just kind of like move them away, or like put them in it, because they kind of eat the flies and stuff like that, mosquitoes, all that kind of, you know. So you gotta. let the circle of life continue.
So you don't kill the spiders?
Sometimes. It depends how, like, you know, when you get, like, the tickle on your arm, just go like that, like, that's the only time I'll kill a spider.
That's really sad.
Yeah.
Right.
Yeah, but the love for animals came, it was just one of those things for me. My mum says my first word was dog.
Is it?
Yeah, and that was the thing. And like since then, I just sit down and watch animals all the time. Nature documentaries, David Attenborough, Steve Irwin.
Who's that guy that died when he was?
Steve Irwin.
Is that him?
Yeah, that was very emotional for me. Yeah, that was very emotional for me. Yeah, it was 2006. No, I'm not gonna cry now because I think I've healed from that.
Yeah,
since. Yeah, you know, I'm okay. But it was just the fact that Steve Irwin was a guy. I used to watch a lot of these things, and Steve Irwin was one of those people that used to bring it to life. Like he brings his passion to life. Sometimes I hope I can do that same thing when I go on TV, but he really brought, you could see how passionate he was about the animals. And as a little kid watching that, it was just like, this is riveting. Like somebody's so amazed by these poisonous things or wrestling alligators or crocodile just jumping into the bush. Like, you know, so that was a big thing for me. And just sitting down reading encyclopedias about animals, going to like history museums, going to like nature museums.
So from a young age, you've always had a love for animals?
Yeah, that was it. That was it. And that's how the vet thing kind of came about, because it was animals and helping people and put it together. And
right. When you say helping people, you mean helping, is it their owners or?
So originally, when I was younger, the whole idea was just helping people. I just liked helping people. I guess it's like the eldest vibe, I guess. Being the eldest child, you're just always trying to please. Oh. I don't know. Are you
middle child?
Middle child is attention, you know. Apparently, this is look at you guys.
I mean, again, it's not about me, but you're right. Yeah, a little bit.
Yeah.
Okay, now that's really interesting. So, are your parents? Are they in the hospital or anything like that?
No,
doctors?
So my mum's a lawyer. My dad does real estate management and consultancy, as well as IT and database stuff. So there's no animals in there. I mean, so for me, it was just came out of nowhere, came out of left field, and my parents are, because sometimes culture can be stifling, and your parents restrict you to do certain things because they think that that's the best thing that you'll achieve in.
So what do they want you to do?
They were very liberal. My parents were very like, look, to my brother, the message they gave to us was, do what you love doing. Find what you're passionate about, and if you're passionate about it, the money will come. Don't worry. So they just used to support me, and because I had them supporting me, that was why I was able to go down this route of being a vet.
No, that's nice. Okay, good. You know, so talk to us through your journey and how you actually became. So you actually have your clinic, or you work in a clinic in Kent, I remember you said.
Yeah, so that was my first job, was actually in a clinic in Kent, yeah.
Okay, so like, I want to know from like...
The backtrack.
Yeah.
So I mean, I guess it's the same with a lot of medics. Medics in general, you tend to plan your life years in advance. So you're planning like 10 years in advance. And I think maybe about the age of 8, I kind of looked at what universities I wanted to go into. And University of Liverpool was one of them. And because the University of Liverpool at the time, there was only 7 universities that did veterinary medicine.
I know, we've got to go back a bit.
Okay.
So I want to talk from like school days.
I'm talking about 8 years old. This is 8 years old. I'm
sorry, I'll let you
let me go. So this is the thing. So in the UK, there was only like 7 universities that did veterinary medicine. And I'm talking about at the age of 8, I used to look at what universities I wanted to go into.
At the age of 8?
Yeah, exactly. So this is the thing, because I knew I wanted to go into the thing. And as a medic, you have to gear your whole life towards becoming a medic.
Right. Okay.
So I had to look at, okay, how am I going to make this dream a reality? And that was the vision.
From 8 years old?
And we're talking about from 8. Look, if all my friends who know me from when I was a child, the one thing I always rave about, I'm going to be a vet. So that was the thing. And so from about 8 years old, I looked at universities, and University of Liverpool, the reason I chose that as a university is because it had the biggest entry requirements that you had to tick off, like work experience. So I just started working in that direction. So if we fast forward past that, you do 11 plus, you get to GCSEs. I started doing work in like animal shelters and kennels and all those sorts of things, building up my work experience. Then we get to about GCSE time, where I started like volunteering at this animal shelter in Swanscombe, which is like Kent.
Was that the first time you volunteered for an animal shelter?
I volunteered at like RSPCA stuff, and I worked at kennels as well. So it wasn't the first time, but it was the first time I'd worked at an animal shelter of this magnitude, because this one had like, they had like 60 dogs that ran around. They had cows, they had pigs, they had like 3 big Shire horses, they had like pigeons, seagulls, foxes, like everything, like turkeys, chickens, everything. And so I used to go there after school, and I used to like and this is before I could drive.
Did you have a favourite animal?
No, my favourite animals were always large animals, like wildcats, like leopards, panthers, and like lions. I used to just think they were amazing. Like, you look at them and you're like, this is...
What's that
Amazing
animal
thing.
where when the feathers come out, it's all different colours?
What, peacock?
Yeah, I like what peacock?
I was like, wait, there's a peacock. But yeah, so
I like
I'd
peacocks.
kind of gone down that lens of getting all the work experience and all that sort of stuff and gearing myself up for the application. I'd done all my sciences in GCSE, then progressed into A-levels naturally, as you would. And then at the time of application, like everybody tells you when you're going on the veterinary medicine route that you're going to experience rejection. It's the same as medicine. You're going to experience rejection. Like, be ready for it.
So sorry, I just want to backtrack a little bit.
Go for it, yeah.
When you say GCSEs, what did you study for your GCSEs?
So my GCSEs, I think, I can't remember. In my school, I feel like we did I think I did 10 or 11 GCSEs. And I did all the sciences and maths, because those were you had to do those to make sure you get into the vet school. So that's biology, chemistry, physics, maths. Then I did, what else did I do? Okay, so I did history, did geography. Wow, GCSEs are so long ago, can I even remember it? I feel like I did art as well. PSHCE, I'm trying to recall these things. Economics. At GCSE, we could take an A-level early, and so I did A-level government and politics, AS level government and politics. I remember doing that as well.
So you had to choose which subject to study, knowing that you're going to be a vet.
Yeah,
so you
exactly. This is why I say at 8 years old, you had to be selective. And the main important one was having the sciences and maths, because a lot of people,
I would have failed then.
You can't get into medicine without, it's tough.
Yeah.
But,
so if you didn't study maths, you wouldn't have been able to get into medicine?
No, there are different ways, and this is what I talk to students about. There are different ways in which you can get onto it, but ideally, primarily, you want to look at what the university is requiring for that one course, because if you haven't taken those GCSEs, but usually people tend to realise that after they've done their GCSEs or after they've done their A-levels, then there are deferred entries like foundation courses or that sort of thing.
Yeah.
But at the time, I knew I just kind of want to go straight into it. So going straight into it, you need X GCSEs and X A-levels. So.
Okay. So what was the hardest thing about studying?
Commitment. I think it's commitment, discipline. When you're going into medicine, you have to be disciplined about how you work. And I come from a disciplined household, but it's knowing what you want and also knowing not to waver from it. So there's one side of having commitment, but it's different of having an unwavering commitment, knowing that, look, all I can see is I want to be a vet and I want to achieve it. I didn't even get to where I was going, because once I finished my A-levels and I tried to apply, I had all these different things in my application. Yeah. In terms of I was deputy head boy at my school. I'd done 52 weeks of work experience.
What did you have to do to be deputy head boy?
It was just teacher recommendations, things like that, good grades, all that sort of stuff.
So you're quite intellectual in general.
You push yourself in that
12
direction.
GCSEs, you know?
No, but you have to push yourself in that direction. It's I think intelligence, everybody has intelligence, and academic intelligence just comes from a fact of that you just answer the right questions in a test. It's not a very fair marker. It's not. Look, academics isn't the only way to measure intelligence, and
it's true.
It's messed up that at school. It's that quote, that Albert Einstein quote. If you judge a fish consistently, if you examine a fish consistently on its ability to climb a tree, the fish is going to spend its whole life thinking it's stupid. You can't. There's different ways to metric intelligence. You know what I'm saying? But academics, you just have to kind of be committed in that sense, and it falls into place. But yeah, I applied and I got rejected from. Yeah, so you mentioned that's what I was going to go through.
So many, you got rejected from so many. So tell us about that and how you kind of dealt with that experience when you finally got accepted. Tell us about that whole.
Yeah, so I mean, I applied to. We could only apply to 3 vet schools out of the 7, because you had to do one as your backup, and my backup was zoology.
Zoology?
Yeah, zoology, which is study of animals.
No, I want to Google it first.
I've beaten you to it already.
Zoology.
Can you do
the
some graphics and bring it up on the screen?
Study of the behaviour, structure, psychology, classification and distribution of animals.
Now say it again without looking at the phone.
No, I'm not. So basically, in short, it's the study of wild animals.
yeah.
Right?
Are we acting like I didn't say it like?
Huh?
Are we acting like I didn't say it like?
No, but you didn't say wild animals.
It's the study of animals.
Did you say yeah? But it's wild animals.
I mean, and domestic animals as well. To be fair,
so that means being a vet is not studying animals.
No, because in zoology you do that as well. So in veterinary medicine, you study zoology as well. But zoology.
What did you say?
Veterinary medicine.
Veterinary medicine.
Yeah. So in veterinary medicine, you study zoology as well. But zoology was a separate bachelor's, so I used that as my backup. Okay. I got accepted for that, but that's not what I want to do. I want to do veterinary medicine. And for the 3 universities I applied to, everybody told me...
So tell us what the universities were.
Nottingham, Edinburgh, and the Royal Veterinary College of London were my 3 choices. Oh, did I apply to Liverpool? I can't remember now.
Probably did.
Yeah, I can't remember. I feel like I may have tried to apply for Liverpool. So maybe it was 4 choices and a backup. But
So you got rejected from 4?
I got rejected from. I didn't even get an interview.
Is that bad though?
I didn't even get an interview. So for me, like at the stage where I was at the time, I was predicted A-star AA. Had all this work experience. I was supposed to be like a glowing student, and everybody told me that my application was fine. You'll get an interview, smooth sailing. And I just got rejected by everybody.
How did you feel?
Devastated.
So you're intellectual, you've been top of the class, head boy, and you got rejected.
Yeah.
Was it like a humbling moment for you, Bolu?
It wasn't. Humility is something that I feel like I carry. It's not because I'm only saying this stuff in hindsight now. You know what I mean? I'm only saying this stuff in hindsight. Oh yeah, I achieved this, and I'm proud of it. Yeah. But and I'm proud that I achieved those things. But at the time, it was just doing what you needed to do to get into vet school. You know, and for me, it wasn't necessarily that it was humbling, more so in the sense of my whole world crashed because that was all I ever wanted. Like I said, from age of 8, that's all I looked at. That's all I ever knew. I spent time, reading after hours or my lunch times or sacrificing so much. I used to go to the shelter in the cold to help these animals in the snow. I wasn't driving. Like in the dark, I'd stay out till like 9:30 p.m. or whatever and come home late because I was just trying to help these animals to help myself get into vet school. And to get rejected, devastated. And I remember like I was walking my dog. I remember at the time I was walking my dog at the time and I was having my head down and I was moping around and my mum was like, you need to pick your head up. Like you can't keep walking around with your head down, And it kind of demoralized me at the time because it was just, what's the point? Yeah. Like, why am I doing this anymore?
So you got rejected from 4.
Yeah.
And then finally a letter came through.
No.
No letter.
No fairy mother, no nothing. There was nothing. What happened was I got rejected and then I started to face my exams because it was very late in the season. All my friends were getting their acceptance letters and I was waiting for my last rejection. Got rejection around May time. Exams were in June. Did the exams. I was a little bit demoralised when I did it. And I thought to myself that maybe I'll do a gap year, maybe I'll repeat the exams, whatever it may be, to try and make my application more glowing. And I took the...
Just to understand, you don't take an exam when you've got the role.
No, yeah.
You take it before. So it's not, is it like a separate something that you have to...
So the way it works is that you apply say we apply in November, you apply to what university you want to go to in November.
Yeah.
And then you get your offers from the universities around March time or so, and they're all conditional offers.
Based on the exam?
So based on what you get in your exam in June.
Right.
Yeah, so they're conditional offers. They say, we'll let you into university if you get AAA. Yeah, and you have to get that in your exams coming up in June, and they tell you this in March. Okay? So for someone like me, I got all my rejections and then I had to face my exams. So I got rejected and I had nothing that I knew I was going to do. Yeah. I had to do the exam. So I was like...
but you still did it, right?
Yeah, of course, because you have to do the exam to complete your A-levels. But I was very demoralised at this point because like, what am I working for? What am I doing it for? And so the whole idea was that, okay, maybe I'll take a gap year or whatever it may be to pass time, because a lot of medics take gap years and then try and apply again. And so I was anticipating taking a gap year, so I did the exams and then I flew off to India for 8 weeks with like a volunteering scheme.
That's not fair.
Yeah, and it was like a volunteering veterinary scheme, and I had.
How was that different from the UK?
This was
being a vet in the UK. How was that?
So it wasn't that it was. Of course, it has its differences because of what they can have technologically speaking, like in terms of their accessibility to what is in medicine. Because I was working with like a village, a government hospital, and a farm, and their access to medicine is different. And the reason why I went out there is because there, if you're a student and you're going out to learn, they give you more responsibility to do things. Right. Whereas in the UK, there's a lot more restrictions because of health and safety and all those sorts of things. So I flew out there and I was shadowing vets out there and they were teaching me all these different things and I was opening my eyes out to what vets really do, especially in that kind of scenario where they have so many exotic diseases, or, I got to see elephants or treat goats, as well as treating small animals like dogs and cats and all that sort of stuff. And this was always like a voluntary kind of give back sort of thing. So I was there for like 8 weeks, yeah.
So how did that change your life, doing volunteering in India, in different places of the world? Because I know you're quite well-travelled as well.
Yeah, I mean, my family, we like to travel as a family, and going to India for me was kind of like, that was me going by myself, and it wasn't my first solo trip, but it was one of the earlier solo trips, and this was like living with a different, like, I lived with a host family, so I stayed with an Indian host family. And I got to meet other volunteers from around the world, and it just, I think it added a bit of independence. It bolstered me with a bit of like independence. And also just being able to open my eyes out, like the kind of things I saw in India, you know.
Crazy.
Yeah, crazy, like crazy. And when trying to walk to work in India, or even just exploring, and like on the weekends we used to go traveling as a group and all that sort of stuff.
Yeah.
And like also learning how to budget when you're away. Because where's money coming from? The money's not, you know what I mean? I had small allowances that you'd earn from the clinic or whatever, and I'd use it on the holiday. And obviously it's India, so things were cheaper. And I remember I found a gym out there, which was like some, like, just, and they wanted me to be their Mr. Olympia for this little lady, because I was just this tall, like, skinny kid that was, but they were like, you're big, so you can go to it. And I was like, no, I'm just here to just,
look after the animals.
So yeah, that was great, and I came back to England for results at the end of the summer, and my results weren't quite what I wanted. I can't remember what they were. Whether
you
they
probably
were
got
double A,
an
B,
A,
or
an A, and an A, but because they weren't 3 A stars, it just probably wasn't.
No, if they were A, then maybe I would have got in. But I mean, they were double A, B, or double B, A, something like that. And I remember just, again, being devastated and trying to apply through clearing, which is like a option that you can call up the universities at the time and see if they have spaces. And nobody had any places. And I remember talking to my parents, and they were like, no, you have to do this veterinary thing.
So they were still pushing you, even though you were kind of...
Yeah, because I was dejected. You know, I was like, at this point, I was like, why am I doing this? You know, like, what does God want from me? Like, you know, and I remember when I said that to my dad, he was fuming. Like, what do you mean? Like, he's like, come on, we're doing this. And he was the one who actually said that, look, they need vets in Russia. If you have to go to Russia, you will go to Russia to learn. And I was like, and I was talking about stuff about physiotherapy, and he's like, what? Like, no physiotherapy, that you'll be a vet. And
no, I love that.
And then to kind of break down the scenario, it was like, this is like the last week of August, and somebody somewhere, whether it was through my dad's working colleagues or whatever, mentioned about studying abroad. Yeah. And the topic of Hungary came up, and I went to Google search it. My parents told me to search it and do the research, and then, somebody told me something about going to Budapest, and then I flew out to Budapest to do this interview. I found out there was a vet school in Budapest, so I flew out to do an interview and an entrance exam, and I got interviewed by like the head teacher at the time, the dean at the time.
So how old were you here?
I was still 18.
18?
No, not even 18, 17.
Wow.
Yeah, 17 or 18.
And this is after India?
Yes, it's after India. Yeah, this is after India. And I flew out, did the interview. They basically just accepted me within a heartbeat. And that was like that was that. Because
so you were really happy about that?
Yeah, because it was a very confusing moment at the time, because the way that he said it to me, he was doing my exam, and then at the end of the exam he said, so if you come to Hungary, what will you do about accommodation? And then I said, well, if I get the place, then I will look for an apartment, And he's like, don't worry about if, you've already got the place. And I was like, whoa, wait, like what? Like after all these hurdles that I do, like, wait, you're just giving me a place? And then, so I flew back home. I remember calling my parents at the time, and then I flew back home. I took a stroller. My friends, all my close friends, didn't even know what was happening. I kind of took a stroller, and then I went to Budapest, and I lived in a hostel for 2 weeks of university. University started the following week, like 3 days after that whole scenario sort of thing. And I lived in a hostel for the first 2 weeks, and then I found an apartment in the city, and 6 years later, came back home, started working.
Okay, wait, pause. So you were in Hungary? Yeah,
Hungary. Yeah, Hungary.
For 6 years?
Yeah, 6 years.
What do they speak there?
Hungarian.
Should have known that, shouldn't I? Okay, so
let that one slide.
Did you have to learn the language?
No, just small things to, charm old ladies and get around the supermarket, that sort of, just the tiny things. But the course is in English, so it's international. Sorry guys, we're back for the technical.
You do that. Yeah, you do it. Yeah, I don't know.
That's the end of the year, is it?
Yeah.
Mad, wow. Saving the best to last. We're live from Saturday night. We're live. And this is, I'm telling you, Just looking at me like the lack of professionality.
Hi guys, sorry, I didn't know we were back. Sorry guys, we're just having...
And we're back.
We've been having some technical difficulties on our side. Hi Crystal, thank you for welcoming us back. I didn't know we were live. So, Dr Bolu.
Yes, where were we?
We were talking about your time in Hungary. I can't believe I was there glossing my lip and you guys were on. That's really embarrassing. Guys, I just want to remind everyone, this is actually our last stream of the year. You should feel honoured, okay?
It's the last kind of episode.
Yeah, something like that. Yeah. So it's our last stream of the year. So any questions you have, again, please make sure you send them in, and please make sure that you like the video as well, so it can help us get the views, okay?
You know, smash the like button.
Yeah, but there's not going to be a thing at the bottom. Anyway, smash the like button is actually what you said.
Button, comment, subscribe, and hit
all
the
of that
bell,
stuff.
you know, so you can get a notification when we post next.
All of that stuff, guys. Cool, so let's get back into it. We're talking about you got accepted into the veterinary school in
Hungary.
Properly in Hungary, and then you were there for 6 years. I want to know a little bit more about your life out there. Yeah,
Amazing. I think everybody.
Was it lit though?
It was.
Was it?
It was. Yeah. It was.
Was it?
I was the part. Do you know? It's funny. It's funny. No, but it's funny. As you say this though, it's funny because I was like the only black person in my university. And I remember one time FaceTiming home because my little brother was home, and I remember saying to him that I wanted to wear socks and sliders to school, but it'd be weird because nobody knows where I'm coming from. We're talking about, this is before people were even wearing, like, you know, in the UK everybody was kind of wearing socks and sliders out, but not quite. It was kind of happening. Yeah. And I was like, yeah, I want to wear it to school, but there's no black people to do it. My brother was like, you are the black person. You just be you.
So you did it.
Yeah, just be you and do it. And it's funny because I bought it from a shop, and it's like the most stereotypical thing I could have done because the sock had like patterns of marijuana. I was like, oh, but I wore it anyway. You know, and I was just representing like.
How did it go down? Everyone loved it. Oh, they didn't care.
Yeah, I mean, they were there with, like, you know, it was there and. It's just, it is what it is. Like,
did you find that you bunched up with the other people from the UK when you were studying there, or? No,
I mix it, because in my school I kind of became like a landmark. Like, you know, if you see the black guy, you've gone too far. Anatomy lecture hall the anatomy lecture hall is on the left. But if you see him, you know, so it was kind of like, you just mix with everybody. Like, I had Norwegian friends, I have Spanish friends, Cypriot friends, whoever. My best friend is Indian, he was from the UK, funny, but like my immediate group of friends were a mix, like a guy from Lebanon, some people from Greece, and we just mix whoever you catch the vibe with, who you mix with.
Nice. Okay, so what was study life like? Obviously, I spoke to a lot of medics, as you guys know, and they're telling me that exam stuff out there, or not out there, exam life, sorry, is nuts. So tell me about your studies.
Yeah, so we had a joke in Budapest that, because there was a medical school as well that was in the centre of town, and there was also a dental school as well. And so there was the vets, the medics and the dentists. And we used to say that in our school, we used to say real doctors do more than one species. So I'm coming with the doctors are here. Yeah, we say it to the doctors, it's coming out the doctor. But we used to say because of the fact that vet school was very intense in the same fact that medical school is hard. It's hard, period. But you're learning one body. When you're in vet school, you have to learn the difference in body systems. So you're doing dogs, you're doing cats, you're doing horses, you're doing pigs, then you're doing birds, and then you're doing your small animals like your rabbits and things like that. The other bonus is that when you're a medic, you can ask your patient, where does it hurt? You can't do that with a dog. The dog won't tell you where it hurts.
You can cook the area and then the dog will like...
Supposedly, but you don't... That's if it's obvious, like a wound or something like that. But if a dog has a neurological symptom or hemorrhagic gastroenteritis or whatever it may be...
Sorry, who?
Gastroenteritis.
What's
like diarrhea and vomiting. Like, it's a very bland symptom.
Right.
So if they have diarrhea and vomiting, then how do you distinguish...
How do you diagnose them?
Yeah, how do you diagnose it? All those sorts of things. And also learning your difference in medications, for instance. So like how medications can be used across different species and what species react to different medications.
Right.
Also, what are the common diseases that come up in those species and the most common ailments that you'll find in those species. So you have to learn all those sorts of things in vet school. And then it's also like the biochemistry and the biophysics of each of these animals and the anatomy of all these animals. You have to learn all these things. So
Dr. Emma said she feels attacked.
and you should feel attacked. You should very well feel attacked. You should feel attacked. I'm looking at the camera and I'm telling you should feel attacked. You should have gone to vet school instead. But yeah, it was intense. We had like an exam every week.
Every week?
Yeah, every week. It was very intense, and our exams were different. Our exams were oral. So you'd have the lecturer quiz you on maybe 250 to 500 topics sort of thing. And he'd just have a desk with all these cards, or you have a topic list and you have a desk with all these cards, and you might pick up, I don't know, the biochemistry of like this, I don't even know, like maybe the Krebs cycle, and you have to go into detail about
the what?
The Krebs cycle.
What's a Krebs cycle?
It's a cycle for how we produce energy in the body, but that's like, this is stuff that I don't even remember using anymore. It's how we produce. Have you ever heard of like ATP or glucose? Glucose? Have you heard of glucose?
Glucose is sugar.
Yeah, exactly.
Right?
Yeah, so like how your body utilizes that to produce energy.
Okay.
Even though I might be butchering this, students might be hearing me and be like, "Nah, you're way." I actually can't remember the Krebs cycle. Like, do the doctors even remember the Krebs? You remember the Krebs cycle? How many ATP you produce in the Krebs cycle? 33?
What's ATP?
35? It's energy. It's the energy that.
All right, sorry.
We're going too deep.
We're
going too deep, but yeah. But essentially, you'd have all these oral topics, and you'd have to sit in front of the lecturer that taught that topic.
Just you?
Yeah,
By
when
yourself?
you're doing your exam. Yeah, when you're doing it. This is how our exams work.
Once a week?
No. So there's finals, and the once a week ones might be written ones, like multiple choice or written exam questions, like a normal exam. But the finals would be oral, so you'd have to know your topic list inside and out, and then you pick something at random, and you'll sit there and prepare your script to do.
Yeah, that's long.
And they'll really quiz you and poke you. And also, because it's a face-to-face, if you weren't in any of the lectures, he knows that you weren't in any of the lectures. Or if you start babbling garbage,
he's gonna know.
He's gonna know
waffling.
that I took this. You're waffling to me.
Yeah.
You can't do this. So, yeah.
So did you get to like enjoy yourself out there, like nightlife?
Yeah. Budapest is amazing.
Right.
Budapest is great, and it's work hard, play hard. There were times off in between, and summer used to be amazing for me because after we finished our summer exams, and I'd stay in Budapest for maybe 2 weeks or so before I'd come home, just to enjoy without responsibilities.
So are you happy that you studied abroad, and you're happy that you didn't actually study in the UK? Do you think life would have been really, really different?
Yeah. I think the big one for me was that in the UK, what I noticed that a lot of my friends or a lot of people that I knew, like who you said at the beginning, is that you tend to gravitate to people that you know or people that had the same experience. So that's how you tend to move into like ACS and all those sorts of things, and like, you just hang around the same people with the same mindset as you. But it becomes an echo chamber. Whereas when you go to a different country, your friends are different. So you just experience things differently. You learn things differently. You have to adapt differently.
So would you advise people to study abroad?
Always. I would advise anybody, even if you're not necessarily studying, just to live abroad. Even if you're living for a month.
So where have you travelled to? India, Budapest, Hungary, Mount Everest. Where is
Everest is Nepal.
Where?
Nepal.
Where else have you travelled to?
Like a lot of places. I think the places I haven't been to, I've not done South America, apart from Mexico. I've done Mexico. I've done most of America. I've done Canada. Let's kind of go around the globe. And then England, we've done most of Europe, so like Portugal, Spain, Cyprus, Malta, Germany.
So is this doing your job?
Doing my job, holidaying, seeing the world. There's so much of the world to see. This is why I love to travel. There's so much of the world to see. There's so many cultures to experience. There's so many things to learn, that why just stay
in one place?
Yeah, originally I wanted to move to America. I was actually supposed to move to America last year, but that cancelled because of COVID. And also last year in America was
bad.
Yeah, and it really, I've always been that person that's always been like, yeah, go America, don't worry, it's in patch. But last year it kind of, it put me off a little bit. And so I was just like, you know what, let me just bide my time in the UK for a little bit.
Okay. Okay, cool. Thank you. So let's move on. So you work in a vet, what's it called? Is it a clinic? A practice? Let's call it a clinic. So you work in a hospital in Kent now?
No. So my first job, the best advice I ever got from a doctor when I was doing experience was, when you get your first job, work far away from home as possible.
Is it?
Because then you can make the most mistakes and then nobody knows who you are, and then you come home.
So do you
to
think
kinda
that
work.
advice was good?
It was good advice. Yeah, it's good advice. Like when you're learning and you're starting off. So I went deep into Kent, and I was in Kent. I was doing mixed animal practice.
Deep into Kent, but...
I was in Ashford. When I was working, I was in Ashford, Canterbury, and Whitstable.
You was deep into
That was deep. Yeah, that was deep.
Those are my ends.
I was in 3 practices there. That was deep Kent, and because I was doing mix, so sometimes you do a little bit of farm, you do a little bit of small animal, and yeah, I was there for a year and a half.
So did you make many mistakes? How
always make mistakes. You're still gonna make mistakes. Like that's part of medicine. I always describe the transition from vet school to the real world as a driving. When you do your driving test, yeah, you pass. When you do your driving lessons, you're learning maybe like a Vauxhall Corsa sort of thing. You know? When you get given your license, you get to practice on your new car. But in the vet world, it's kind of like you have your driving lessons, and then all of a sudden somebody gives you a Formula 1 car and says, go. That was what it was like when you get into veterinary medicine. Like my first day, I had to operate on my first day. I had a bitch bay.
You had a what?
A bitch bay, so female dog, it's called a bitch. A spay is an ovary hysterectomy, which is where you take away the ovaries, uterus.
Oh wow! So this was on your first day.
This is on my first day. So this is like my first operation, sole charge. So.
Was you scared?
Of course, because I can count to you my first seven spays, because they're all the things where everything that you don't necessarily want to go wrong goes wrong. But I had the surgeries my first day. I had consults. I had a house visit where I had to do euthanasia.
What's a euthanasia?
Putting an animal to sleep, so end of life kind of thing. So, and this is all before I could even work the computer systems.
That's crazy.
And this is like so it's like you just go straight into it full pelt. And yeah, like surgery is something that I love. I love operating. That's what I want to specialize in: is soft tissue orthopedic surgery, bone surgery.
Soft tissue orthopedic.
Soft tissue and orthopedic.
Orthopedic.
So soft tissue being anything like from like lungs, liver. Soft tissue is all the stuff that you can palpate, and then orthopedics, bones. So
is cartilage soft tissue?
Yeah.
It is.
Yeah.
Okay, good at this, guys. Okay, good at this. Okay, good at this.
What's made out of cartilage in your body?
I don't know.
Yeah,
I don't have a clue. What's made out of cartilage in my body?
Yeah.
Okay, I'm gonna answer this after you. So the ears definitely here.
Yeah. What else can you think of that might have cartilage?
Don't tell me that. No, don't. Your knees have cartilage. Your elbows have cartilage. Yeah. No, they do.
Tiny bit of cartilage.
No.
Not much in there. In your knees, your menisci are made out of cartilage.
Your who?
Your meniscus. They're like soft pads that are inside your knee. They're like shock absorbers.
Meniscus. Okay.
Yeah,
what else is made out of cartilage in the body? Help me then, doctor.
You don't have to list all of them. You know. I was just pulling your leg. You know?
No, I actually want to know another place. You don't know.
Your ribs, so you've got parts of your ribs that have, there's the false ribs as well that have cartilage inside them.
Oh, wow.
Yeah.
Yes, Mika, I said ears. Yes, Emma, I said nose. Okay, thank you for your help. Okay, so...
Well, so you can have a pig replacement, a hip replacement on a pig. You actually can have a hip replacement.
Can you?
Yeah. I prefer hip replacements in dogs. I actually got something on my Instagram somewhere, deep in my Instagram. If you scroll all the way down, there's a total hip replacement on a dog. That was one of the first times I saw the full total hip replacement. It's the same thing as humans, titanium alloys that you use to replace hips. Because things like German Shepherds, Labradors, bigger dogs that have hips.
My leg hurt with all this hip replacement.
Yeah.
Okay, cool. So we are going to get a bit deeper into the clinic. What's it called? Are you allowed to disclose that? In fact,
yeah. So that was in because I'm now out of practice right now. So I was working in Kent before, and then I've moved practice to North London where I was sole charge. So that was just me running a GP practice. But GP in veterinary is different to GP in humans, because GP veterinary, when you're a general practitioner veterinary, you're an obstetrician, you're a paediatrician, you're an emergency and criticalist, you're a radiologist.
You're doing everything.
You do everything. You do dentistry, you do the X-ray, you do imaging.
How large was the team?
Just me. So it's me, and then I had a head nurse, and then I had a student nurse, and then a nurse assistant.
So it's 4
of us. Yeah, exactly. So, but I'm the one who does everything. And then my nurses will help me draw up drugs, help monitor my patients for my anaesthetics. So
when you say your patients, you're talking about animals, isn't it?
There's no patient.
Yeah, it's weird to hear. So obviously, This is what I was trying to explain to Bolu, and we will get to your dog thing as well, because
Okay.
we're going there.
Okay.
We're going there.
I can't remember what my dog
It's weird to hear Bolu talk about animals as if they are humans.
No, I know what you're talking about.
But you know what I'm talking about. But to a vet, they're like humans to you. You said they are living organisms.
Yeah, that's the thing though. It's not a
Guys,
matter
he really
of.
loves
I think.
animals.
See, this is. I think this is the problem on our side of the fence. I think.
What's our side?
When I talk about our side, I'm talking about in terms of, well, when you talk about like a black experience or culturally, our side of the fence. This is how I mean culturally. We don't give enough light to what the animal experience is, or what it means to own a pet, or what it actually means to be responsible for animals. Like, there's not enough. There's not enough.
It's based on understanding. That's all. Like Aaliyah loves. You two would have had a great conversation. She loves animals. I think it's a lack of understanding.
That's the thing. That's the thing, and it's almost there's a borderline of the lack of understanding, but also sometimes it's like. I'm not taking it at you. I'm not taking it at you, but it's an ignorance to it as well. And I'm not trying to charge you or anything like that. That word can be very spiked using it, but like it's a ignorance to it in terms of fact.
See, look at Aaliyah. Agreed. It's all right.
Because the problem is that if we start saying that it's just an animal or it's just a pet, then it kind of belittles the whole reason why I've studied in the first place. You know what I mean? And it's just as complex, if not even more at times. But it's just the fact that a lot of us look at, but then also there's a lot of people that will say it's just a pet, have never owned a pet themselves. Yeah. And when they start to own it and you go through the ownership and you actually understand that the pets get old or pets get sick. I have cats that are diabetic. I have cats with hypothyroidism. I have, there's hormonal conditions. You do surgery. There's thoracic surgery. You have heart surgery, lung surgery inside the chest. Okay. You have everything, spinal conditions, neuro conditions, physiotherapy, everything is there. So, I'm doing ultrasound scans.
Just on animals.
Exactly. I think we have this consistent, a consistent urge to always think that we are number one, like humans, just because we have this stream of consciousness, and that we do things.
Can I ask you a question?
But yeah, go for it.
Do you not think we're number one then? Do you think animals are...
We're equal on this playing field in terms of we're all using this earth, yeah? We're all here together. The idea that we're number one, yes, fair enough, we're like apex predator because of the knowledge that we'll be able to use and harness. But then, like I said again, intelligence as well as our status is measured on so many things. Yeah, go for it.
Ever said, can animals have mental health problems?
Yeah, they do. Yeah, of course they can. Because if you've not seen the attachment between a person and their dog, and we're talking about, I discussed the mental health issue between, like, for instance, during the pandemic, we've had a lot of animals which have been in close proximity to their owners. So that's 24/7 been close, and then the owners go to work now for 12 hours of the day. Yeah. Dogs get depressive episodes. Not only mental health, but when you talk about mental health, you're talking about behavior as well. So dogs have erratic behavior as well, whether it's aggression, whether it's controlled aggression, whether it's fear or depression in that sense as well. So they do have the mental health issues because it's all encompassing of.
I have a question.
Yeah, go for it.
I see a lot on social media, like cats, like they're like biting their carers, like some part of the skin, and they're like sucking it, like for comfort. What is that?
So it depends. It depends.
You know what I'm talking about?
Yeah, I think I have an idea of what you are. And so sometimes you've got suckling cats which may have been weaned too early when they were young as kittens. So the idea of them suckling, like you said, it's comfort. It's a coping mechanism. Yeah. So often when animals have fear or some sort of reactivity, they will try and find some sort of coping mechanism. So that might be hiding, but in some cases it might be suckling. Suckling reminds them of when they were kittens, still suckling on the breast.
Yeah, but there's
it's that kind of, it's a pacifier. But it's the same as when kids suck their thumb.
Got you.
It's pacifying. It's a coping mechanism because it may be closely knit to some sort of trauma or some sort of protective for when they last felt safe. So that's when they kind of suckle.
Okay.
On somebody, or they tend to do it on ears. A lot of cats tend to do it on ears as well, like cats that have that kind of fear and like trauma, I guess.
Okay. Interesting. So I'm going to go now into some of the questions. So we do have some people that sent some questions in ahead of the stream. So again, guys, yeah, exactly. Guys, please do continue to send your questions in and I will try my best to answer them. So Joan, is this your friend, Joan? Oh, no, I know Joan. Hi, Joan. I know Joan.
You're like, you my friend, Joan? Yeah.
So Joan...
What's good, Joan?
So Joan asks, what did your parents, family and friends think about you studying vet med? So I know we touched on it briefly before, but you can...
Yeah, so I mean, this is something that I talk about a lot because I have a lot of these discussions because as black people, we're only like 3% in veterinary medicine and we're always trying to increase diversity in the profession. And how we go about that, I guess, is first tackling the culture and the cultural view of what it is to be a vet. To a lot of my family members, I've always said I want to be a vet, and extended family members might be like, why not a doctor? Why not a human doctor? But for me, it was always just to love animals. My parents always supported it. But yeah, like I said, culturally, sometimes it can be very crippling and stifling, almost like suffocating, because culturally, it's always, you're either a doctor, lawyer, engineer, period.
Yeah.
Whereas my parents are very open to the idea of me being a vet, so they just supported it and they gave me that support.
Awesome, thank you. Joan, I hope that answers your question.
So.
And how do you pronounce Afi?
Afi, yeah.
Afi says, have you ever had an agitated patient and how do you get your patients to be calm?
So yeah, okay.
Wait, the patient is the animal, right?
Yeah.
Okay.
So you're still trying to. Yeah, literally. I think that depends on your ability to handle animals. Different vets have different techniques. For me personally, my day-to-day life is very busy, and like the amount of consults I might have a day, I might see 20 people in the morning, operate in the afternoon, and then another 20 people in the evening. And you're seeing people back to back to back in terms of 10, 15 minutes. Now, you have to get a dog or a cat that doesn't trust you to trust you in 10 to 15 minutes to pull, prod them, poke them, do whatever. A lot of it is body language. Animals are experts in body language. So
like, tell me what you would do or show me.
So a lot of it is, it's not necessarily showing what I'll do, but more so it's the presence of yourself being there, because when a dog doesn't know you, you have to be able to be less intimidating. You have to also understand what their perspective is and understand their behaviour.
Why they're
and
scared,
their body
what
language,
they're thinking about.
What they're scared, whether they're scared, whether they're in an aggressive state, whether they're in a fear state, and all the small little warning signs. So it's all about understanding all of them to build a bigger puzzle so that you can understand how you can react to it and then go into the situation. Also, it's also about me breathing, also about me being calm in that situation, because if I'm ever stressed,
dogs can tell when you're scared, can't they?
Yeah, they can tell, but I don't really get scared of dogs, but it's more so if I'm like stressed from that day because I've had a very stressful day, then it can manifest in how I'm approaching or how I'm standing. So it's all about reflecting on myself, breathing, discussing with owners, being able to make the animal feel comfortable, and then doing my physical exam, etc.
Okay, awesome.
So, yeah.
Very knowledgeable, aren't you? So another one was, what's the primary thing you'll be doing now that you've left work as a vet? So before we answer that question, so you are a vet, but you're not practicing
at the moment. It's only been like a week and a half, but I've taken time off.
Yeah, so tell me why, tell me about burnout and all of that stuff. Where was your mental health and why did you decide to kind of take some time out?
Yeah, so I consider myself a big advocate for mental health in general. Mental health in the profession is a big thing for me because vets have the highest suicide rate amongst lots of professions. Yeah, and it's not only because of how intense the veterinary field is, but more so vets also know how to euthanize themselves. They know how to conduct euthanasia, so I could easily put an IV in myself. But not only that, we have accessibility to the drugs that we can euthanize with. And a lot of vets are going through that day-to-day. Vets, despite what people may think, vets don't get paid much. Vets get paid less than teachers. Not saying that teachers don't deserve a high salary, but vets get paid less than teachers, get paid less than junior doctors.
What?
You know, they don't get that salary, but they're working full on like specialists and doing all their work. And so for me, a big thing of why I left work is more about self-preservation and longevity in the career. I just want to be able to do the career for a long amount of time and do it for 40, 50 years. And the pace I was going, because I've been running a practice by myself, sole charge for the past year and a half. And it's been very busy because one, there's a vet shortage in the UK. There's also a national puppy boom and cat boom. So everybody's adopting cats and pets because of the pandemic and people feeling lonely and all these sorts of things. Yeah. And not only that, but then we're also facing the pandemic and COVID restrictions and all those different things made it difficult. So there's supply chain shortages, but my days are busy. I'm at work 12 to 13 hours a day. And it's just not feasible for me to keep going at the rate that I'm going because, like I said, I'll see people in the morning for like 20 people. I'd see like 9 till 11. Then from 11 o'clock till 4 o'clock, I'd be operating. I might have 6 operations in a day, and then I'll come back and consult again from 4 o'clock till 8:30 till 7:30, and then 8 o'clock I'm writing my notes, all that sort of stuff. I might leave at 8:30 if I have nothing else to do.
So can I just ask you a quick question? How comes you didn't have a partner, like a working partner who does the same amount of things that you do?
Exactly. So this is where we get into like kind of management things and all that sort of stuff. And the clinic that I was at is a sole charge clinic. So it's supposed to be just a sole charge kind of referral clinic, a satellite clinic.
What's a sole charge clinic?
Sole charge is that one person's there. One person's managing it.
So you chose to...
Yeah, so I chose to kind of go into that role.
Right.
And originally when we're starting, the capacity was about 1,800 clients. And so at that time, I really discussed with the local managers at the time that, look, 1,800 clients, that's a lot of clients for one person to handle, but I'm fine, but I'm at my top of a limit. The scale up, because this is what I mean by the pandemic and the puppy boom, is that I'd gone from 1,800 clients in a year to 2,700 clients.
Yeah.
So now physically, there's not enough of me to go around. My active client list is 2,700 people.
Oh my gosh,
and
is that a day?
all their pets. No, so that's active clients. So those are all the people that could be calling or results that I have to report or like in total, that's what I'm responsible for. Exactly.
No, that's
it's
nuts.
a lot, 2,700 people is a lot of people to have to bounce back and feedback at any given time. So, and it just became very labor intensive. And I love what I do and I love being on top form all the time, but it's a matter of, again, sustainability. How can I keep it going? How do I manage it, the output, so I don't burn out?
Yeah. So how did you manage it?
So part of it is being able to spend the time where I can, but this is where it came to a point of where I discussed things with managers, try to get another vet in or whatever it may be. But it just didn't come soon enough. And I just felt myself getting tired and I didn't want to get to a point where I started to resent my job.
So did you feel yourself getting frustrated?
It's not frustrated, it's more so tired, but it's not really the tiredness of it, it's more so the fact that I'm missing out on life.
Okay.
Not in a sense of, oh, my life is going da-da-da-da-da. No, it's more a sense of, like, if I'm with my friends, yeah, exactly. If I'm with my friends on a Friday night, I can only stay till a certain amount because I have to go to work on a Saturday morning.
You worked on a Saturday?
Yeah, I work Saturdays and Sundays some days as well, so it'd be Saturday and Sunday.
Wait, so sometimes you would work 7 days a week?
10 if you go. So I'd go Monday, Tuesday. I usually have Wednesdays off, but it'd be Monday, Tuesday, then it'd be Thursday, Friday, Saturday, Sunday, Monday, Tuesday, Thursday, Friday. You know, and so it became, so you're seeing that and you're doing like 12 hours.
Jeez.
Those that it's very intense hours and you're just...
You really have to love what you do,
exactly.
To be there for half of the day.
Exactly. And we're talking about 12 hours, but I'm at work 12 hours. I've still got obviously my commute to work. I go to the gym in the mornings. All this sort of thing. You still want to try and sleep for 8 hours. You don't, how much time do you have left?
Yeah.
You know? So you don't. So, and it's those kind of things of socializing and being present for memories, being part of friendships, being part of the family, being, I want to be there for. So it was down to me to kind of scale back my time a little bit. And this is part of why I've taken my break, is just to kind of prioritize and figure out what it is I want, how I want to balance things.
Yeah.
Because aside from doing the vet stuff, I do a little bit of TV stuff here and there. So
he's a celebrity, guys, by the way.
I'm not a celebrity. By any means, maybe Z lists. Maybe, after Z it goes like hashtag,
guys,
question mark, exclamation mark. I'm like on that end of the...
Apparently, someone who's also part of the House of Medics, Mary, told somebody that Bolu was coming today and they got really excited and wanted to come as well. So he is a celebrity, guys.
That's just people being excited.
Because you're a celebrity.
Yeah.
Anyway, so let's go on to some of the questions on YouTube, because I know there's quite a few. Aaliyah, let's go for... Actually, Dr. Abe, could you scroll up a tiny bit? Because I think there's a bit more. Okay, so we'll start with this one. How do you manage to look after a sick animal with an overbearing owner? Communication.
Everything's communication.
Do you ever have to ask them that when you go outside because you're doing the most?
So sometimes it depends. The owner's behaviour reflects on the animals. So sometimes you might have to tell somebody to step outside because the patient behaves better without them being present, because a lot of nervousness, fear and aggression comes from the fact they're trying to protect their owner or whatever it is. So it's stepping them aside. But yeah, all of it's communication. Communication's key. It's like in any profession, but especially when you're in medicine, everything has to be clear and concise. You communicate and make sure they understand what you're saying. At the end of the day, we're at the same team. We're both trying to make Fluffy better. So there's no point for us to go back and forth. It's always just communication and breaking things down and making sure people understand things clearly.
Okay, thank you. Another one from Aaliyah. What do you do if the owner doesn't have animal insurance and cannot afford treatment?
So this is a common thing because a lot of people have animals without getting insurance on their animals, and it's not necessarily that we expect people to be able to fully afford their pets. It's more so that you should have some sort of payment plan in mind. A lot of people get animals without even considering what they're going to have to fork out in terms of money-wise and all those sorts of things. So with insurance, sometimes there's some practices offer payment plans. Some practices work with you to know to do things. Also, we change the quality of care. So depending on what kind, like often when I speak with owners, I discuss treatment plans. This is gold standard. This would cost X amount. This is medium standard. This is.
Do you offer insurance in your clinics, or is that
no? So we don't. Yeah, we can't really offer insurance because it's a separate entity body. So it's a clash of interests. So it doesn't quite work. But I tend to recommend people when they have a puppy, when they come in for the first visit, I'm like, look, go online, do your due diligence, and look for insurance.
Yeah.
You know?
Okay.
But yeah, so it depends. But it's all about managing treatments, managing expectations, different treatment plans for different people, because nobody can afford, let's go all the way to town, do all the investigations and all that sort of stuff. Just work it up like that.
Okay, thank you. Elia, I hope that answered your question. Aziza asked, tips on overcoming fear of animals.
Take it step by step. Even with animals and negotiating their fear, everything's conditioning. Conditioning is just an idea that if you do something and you expect a negative response, you're going to avoid that behavior. So if you do something and you get a positive response out of it, then you might want to do that behavior more. So it's the same reason as that when you get 100% in a homework, your teacher gives you a gold star. That's positive conditioning. You know, your parents might give you a pat on the back.
Yeah.
So if you have a fear of animals, that's I've forgotten what they call it in psychotherapy. It's cognitive behavioral therapy.
I would bloody know.
I think it's cognitive behavioral therapy. And you just break it down into small steps, manageable steps first.
So what would you say is the first step?
So its first step is just even being present in a room with an animal. You know, not necessarily going straight to the animal that you fear most, because some people have like an irrational fear of snakes. Maybe just be in a room with a dog. I have an irrational
fear of spiders.
Yeah, okay, spiders. See, so maybe read about spiders, watch some things about spiders.
Okay,
I think Pixar, you know, you're getting there. Even just talking about spiders first, and then you break it step by step. Or maybe just see a psychotherapist, you know, a psychologist, and you can work up your fear.
Even the word makes me, like, I can't.
I can't spiders.
I can't. Thank you. Aziza, hope that answers your question. And another one from Aziza was, how do you diagnose an animal because they can't speak?
So everything's a good clinical exam. Your physical exam is everything. I think it's the same in human medicine as well. Your physical exam is everything. Good detailed history. Then you want to take a good physical exam. So that's examining eyes, ears, mouth, nose, listening to the heart, listening to the chest, taking time to take temperature, feeling all the joints, all those sorts of things. And then when you graduate med school, one of the best advice I ever had from a lecturer was, keep doing everything. Keep doing all of it. Make all your steps repeatable, because you want to have a good database.
Yeah.
You want to have a good database of what is right, so that when something is wrong, you know that it is wrong, you know? And then that way you know that, okay, the breathing shouldn't really sound like this. The eyes shouldn't really be moving in that direction. Your hair is curling in a weird direction, you know?
Yeah.
And it's like, that all signals you to what next steps you take. You take it step by step to build your diagnosis.
Cool, thank you. And another one from Elia. What would you do if you were bought in an animal which you can tell the owner is mistreating her? So what would you do if you knew the animal was being mistreated?
Yeah, so there's different ethical steps to this, and the Royal Veterinary College always has different advice lines for in case of like mistreatment and things like that. Now, I think a lot of people get scared when they bring in their animals and they're in a bad condition that we might suspect that they're mistreating. It's not that straightforward.
I definitely would. I know my.
Yeah, and I feel like a lot of different families are like that. But it's more so in a vein of, if the history shows that there's this animal's being neglected, or we can clearly tell that the animal's being neglected, then sometimes we can break the patient confidentiality to speak with the RSPCA.
Okay, cool. Thank you. Sorry, other people. Okay, cool. Emma asked, what's the most interesting or exotic animal you've worked with?
Most interesting, I mean, every day is different. Every day is super intense. Like every day is just go. And my cases vary. I've treated snakes with pneumonia. There was a time, even if we go back to India, there was a time where there was an elephant that had this massive abscess on its elbow, and we popped this abscess and it just erupted like imagine like a 2-litre bottle of Coke.
Yuck.
And somebody shakes it, and just was pouring out pus. No, because you stand back, but it was just pouring out pus, and it was like at least over a litre of pus. It was just,
but what do you think caused it?
It had, I don't know, it just had this, I can't even remember that far back, but it's the same way abscesses get caused in people, skin infections or foreign bodies or whatever. So.
Yuck.
Yeah.
Okay, awesome, thank you. Someone else asked.
So snakes have lungs. They do indeed.
Do they?
They have to breathe. How do they breathe?
We don't know that, do we?
I mean, they have to breathe. Snakes breathe.
So what is the lungs?
They're in the proximal third of the.
What's the
Yeah, I know. I was about to. That's why I said it. So imagine a snake like this, yeah.
Yeah.
And then we say proximal is the closest to the body, and distal is furthest away, yeah. So proximal.
You mean close to the head?
In a sense, yeah. In a sense.
Yeah.
So in a snake, if we just split into thirds, so 1, 2, 3.
So it's in the middle part.
Yeah, it's proximal.
So you learn just extra for no reason.
It's not even extra. It's just
in the middle part of the snake.
When you get given language and you have to learn so many languages,
you know,
it's just the better. Because how many times you can say the middle part of a snake?
Yeah.
Nobody's gonna understand what you mean because snake could be this big, a snake could be this big.
It's true. Okay. Joan asks, how many pets do you have?
I used to have a dog. I had to put it to sleep at the beginning of the year.
Is that the grey dog that was on your Instagram?
She's actually white, but
Oh.
That was Chelsea. She was 15 years old.
Sorry, Aziza says, how do snakes breathe? They don't have noses to inhale.
They definitely have noses. I don't know what's there.
All right, guys, you're embarrassing me. You're embarrassing
me. They have a mouth. You guys are embarrassing me.
No, but this is the thing. We're so uneducated in animals. This is why we needed you on.
Yeah.
Isn't it?
Yes, yeah.
So, Bolu, you've actually been on TV. Mm-hmm. Is it on the BBC, right?
Yeah. So it's becoming my second home now. I'm running
the
whole
so
BBC,
tell us what you done on there. What was the name of the show, if you're allowed to say
of course,
that?
Yeah, that's all. It's all been and gone. It was at the beginning of the year. It aired. It's called Pooch Perfect. You can catch it on BBC iPlayer. And if you go on BBC iPlayer, you can see my face. I was the on-screen vet, but I was also behind-the-screen vet. So they booked me as talent, and that's to be the on-screen vet and the on-screen mannerisms and get across veterinary concepts to owners across the UK. But I also did a lot of behind-the-screen things, making sure the animals were okay, doing all the health checks. Also, all the logistics of how the animals were there, working in correspondence with a friend that was also part of the RSPCA.
How long was that for?
So, Pooch Perfect was an episode a week for I think it was about 3 months it was on. The shooting period was towards the end of 2020, so we shot at the end of 2020.
Nice. Did you enjoy it?
I loved it. I loved every second.
So you want to do TV now?
No, I still want to be a surgeon. Okay. I still want to be a surgeon. By any means, I still want to do surgery, orthopedic and soft tissue. I do TV more so as impact because, like you say, nobody knows about black vets and people don't have the education. And
we don't.
You're
the only black vet that I've seen. I've never seen.
Well, let me start reading off my people now because I'm everyone, but there's also Dreddy Vet. That's one of my good friends.
Shout out to Dreddy Vet.
Yeah, so if you just go on Instagram at Dreddy Vet, that's another guy who's doing big things. He's doing TV stuff as well. My friend Mahesh, his Instagram is Mahesh BX, I think.
You're actually plugging people.
And this is another one of my friends. He's not black, so don't be afraid if you go on his page. But he's Asian. And we're part of the whole BAME community within the veterinary profession. In fact, the previous president of the RCVS, Mandisa, she is a black woman.
What's RCVS?
It's the Royal College of Veterinary Surgeons.
Right.
And she is also a black woman, which is amazing to see a black woman at the head of the Royal Veterinary College. So that's also amazing. My friend, I've forgotten her Instagram handle, but she is Nikkei. She is also a black vet, and she's a black woman, and she's an amazing criticalist. So she does critical care night shifts. There are some.
Love it.
We're scattered. My best friend, Dr Kishan Parekh, he's also an Indian vet. You know, there's a few of us, but we're out there, and people are doing it. And in the States, there's a lot more. But if you go into Instagram, you can follow the paper trail and you'll see them.
Awesome. Thank you so much. So guys, it's been a bit of a longer stream than normal. Again, it is our last stream of the year.
Wow.
It's our last stream of the year,
So
guys.
we
we
turning up?
I mean, are you coming to the bully? Exactly. So everyone, please come and correct him in the comments. So as we've been saying, guys, for the past months, we have the House of Medics Winter Ball next week, Saturday, the 27th. It is going to be a whole vibe. 3-course meal, glass of Prosecco. There's going to be wine on the tables. We've got a bar, we've got a DJ, we've got the 360 camera. But you're not coming.
I feel like Charlie Smith right now.
It's going to be lit. So if you don't have your tickets, we actually had to add some more so people can actually fit and actually come and enjoy with us. It's going to be amazing. So from all of us at House of Medics.
And me too.
And Bolu, who's not attending the ball. Thank you guys so much. And everyone from House of Medics, run in. Let's quickly say bye. Thank you guys so much.
Where are these people coming from? Where are these people coming from?
Thank you guys so much.
Bye.
No, Dr Bolu isn't coming. We'll try and get him to come.
They just told me like...
It doesn't matter. Bye, guys.